All right, let's get started. We may have some more people joining us, but that is okay. Thank you so much, everyone, for joining us this afternoon. My name is Debbie Kaltman, and I'm from the Healthcare and Science Career Community team from the Career Center at DePaul. The Industry Insights series is designed to introduce you to different industries or groups of industries. And we're super excited to be doing that today and to look at non-clinical career paths at Rush University Medical Center, a really great partner of ours. Just a few housekeeping notes. We are recording this event and we will send the video to everyone who has registered for the event in Handshake. So you can watch that afterwards. We will have time for a Q&A at the end, but if you have questions throughout, please feel free to put them in the Zoom chat and we can hold on to them and share them at the end. If you would like to ask a question anonymously, you can send a message to me or to my colleague, Betsy Cahill, and we will ask them on your behalf. I'm going to turn it over to my colleague, Betsy, to talk just a little bit more about the Career Center.
Perfect. Thanks, Debbie. And hi, everyone. Good afternoon. Thanks so much for being here with us. My name is Betsy Cahill, and I'm the Career Community Advisor for Healthcare and Science at the Career Center. And I'm going to share my screen and just wanted to share with you some of the resources and services that we have available to you here at the Career Center. So this is the Career Center's website, and I wanted to start off by talking about some of our advising services. So there are a couple of different ways that you can receive advising from the Career Center. The first is through one-on-one career advising appointments with members of our career advising team. And these are currently being held virtually, either through video conference or by phone, and are a fantastic way to chat one-on-one with a member of our team about any questions that you might have about careers, no matter where you are in terms of your career development process. And then we also have drop-in coaching with our peer career coaches, which is a fantastic option if you just have a quick question. Maybe you're looking to submit an application for an internship and just want some quick feedback on your resume or cover letter. You can drop into our virtual Zoom office to connect with one of our peer career coaches. And I will bop over here. So here are the hours, Monday through Friday, 1 to 5 p.m. And again, this is drop-in, so there's no appointment necessary. And then we also have an online resume and cover letter review service. So again, if you'd like some feedback on your documents, you can submit them through this form on our website, and then a member of our team will get back to you with some feedback. So those are some of the ways that you can connect with us. We also have a lot of great information on our website around topics like resumes and interviews, jobs and internships, networking, including our alumni sharing knowledge or Ask Network, which is a fantastic way to connect with alums around career-related discussions. And then I also wanted to share our career library, which is a library of over 50 handouts and videos and tip sheets about a range of different topics, from resumes and cover letters to searching for jobs and internships to planning for graduate school and more. So this is a fantastic place to come. And we also have a page specifically with COVID-19 career resources. So this has some really helpful guidance and tips around finding ways to gain professional experience and develop your skills amid COVID-19. So those are just a couple of particular resources that I wanted to highlight. I also wanted to share with you the Handshake Platform, which you can access from our homepage. And there are a couple of particular things that you can do in Handshake. The first is, this is how you can schedule career advising appointments. So if you come to the Career Center section, that is how you can set up one of those one-on-one career advising appointments with a member of our team. Handshake also has a section where you can search for job and internship opportunities. So if you're looking for ways to gain professional experience, this is a great first place to start in terms of looking for potential opportunities. You can search by keyword and play around with a variety of different types of filters. And then finally, Handshake is also the place where you can find all of our career-related events like we're having today. And these are events that are hosted by both the Career Center as well as by external employers and partners. So you can see some examples of some events here being hosted by some partner organizations. And then we also have several career fairs that we offer throughout each academic year. These are a fantastic way to connect directly with potential employers around job and internship opportunities. I specifically wanted to highlight that our spring career fair is coming up on April 8th. So I would definitely encourage you all to attend that. So with that, I am going to turn things back over to Debbie. And thanks again for being with us today.
All right, thank you so much. Well, now we're going to turn it over to our panel and to our facilitator. They will all introduce themselves. So I'm going to turn it over to Benji Feldheym, Associate Director of Development Communications at Rush.
Yes, hi there. So I can skip the name and title portion. My title means that I work in philanthropy communications. So I develop our website sections, our HTML emails, social media, web analytics, content strategy, and kind of other assorted odds and ends that come along with that. And today I commend you all for joining this, because I'm a big believer that life is pretty similar to the mazes that used to appear on the back of cereal boxes, at least when I was a kid, where depending on which way you turn, left or right, as you went, you could arrive at one of, say, 7 or 8 different exits at the end. And that's definitely how my career has progressed. And keeping an open mind to the different turns, even if it's not exactly what you originally planned on when you were a student, is really key to finding a path that is satisfying and fulfilling in a lot of different ways, not just in the work that you do, but in the life that you get to live. And so to be asking that question, I think is really, really important. And also things change as you actually end up working in those careers. And that certainly applies to me, since I started in journalism and worked as a news reporter for about 7 years, was laid off twice, and was very tired of that in a number of ways. I found actually during a time that my mother was hospitalized, she's okay now, so no worries there. But that there was a lot of storytelling opportunity in healthcare, and a lot of ways to use the skills that I learned as a news reporter in this context, in a way that allowed me to be part of something that I strongly believe in, but also allowed for a greater amount of stability. Provided, during a global pandemic, working in healthcare comes with a whole lot of unexpected. But with that, though, I still find it a path that I'm very happy with. So that's a kind of a short version of my path toward non-clinical work. And let's turn it over to Mitch. If you would introduce yourself, please.
Yeah, thanks, Benji. So as you said, my name is Mitch. I'm a talent acquisition recruiter here at Rush. I've been with Rush for about 2.5 years. I started in November of 2018. I still consider myself somewhat of a new grad, since I graduated, like I said, in May of 2018. So I'm kind of familiar with what you all are going through right now. My heart goes out to all you. I know all to you, because I know back when I was looking for a job after recently graduating and not a pandemic, it was certainly, it's a stressful time, especially throw that into a pandemic. So I commend you all for the efforts you guys are doing, and your upcoming graduation, if you are graduating this spring. I kind of got my start with Rush. I started off after graduation with a business marketing degree and was not really sure what I wanted to do. I ended up at a talent sourcing company called Tech Systems. I was there a short time. That's where I kind of got my first taste of recruiting. And then I just realized it really wasn't a fit for me. I didn't like the staffing agency world, but I liked recruiting. So I wanted to go more in-house and maybe be with an organization that made an impact within the community. So one thing led to another. I ended up getting a coordinator role within Rush as a contract basis. I worked that for about 6 months. And then shortly after that, I moved into a sourcing role. There is where I kind of did some high volume sourcing for medical assistants and various other roles. And then looking up after that, about 3 months into that role, I moved into my talent acquisition recruiter role, where I've been for about a little over a year and a half. And it's just really been great being with such a great organization that makes such an impact here on the west side of Chicago. And really patient safety is #1 here. And it's been a lot, and it means a lot to me working at such an organization. But that's a little bit about me and how I got my start here at Rush. And I'll turn it over to, I believe, Sarah's next.
Thank you. Yes. Hi, everyone. Welcome. My name is Sarah London. I began working at Rush in October 2018. I am a senior residency coordinator. I work for 2 different residency programs, the internal medicine residency program, and then a combined internal medicine and pediatric residency program. Those are trainees who graduated medical school and are doing for the combined program. It is 2 3-year programs, medicine and pediatrics, combined into 4 years. So it's an accelerated program. They get board certified in both medicine and pediatrics. Similar to Benji, I worked in a creative field before working at Rush. I worked as a production and producer's assistant in TV and movies for about 4 years. I worked in Chicago. I eventually made my way to LA, and I lived the Hollywood lifestyle. But I am from Chicago and wanted to be closer to family. And similar to what Benji was saying, it's not the most stable career working in film and TV. So I was looking for something that was a little bit more reliable. Through a person in my personal network, not somebody that I would have considered a professional contact, but somebody in my personal world was working at Rush and connected me to an opportunity to work part-time with the MedPeds program. And it was incredibly alluring to me to have a part-time job that was something totally new. So I felt comfortable taking it on and learning the ropes. Then in October of this year, I was hired full-time to work for the internal medicine program as well. So I'm happy to be here tonight. Very excited to talk to all of you. I certainly love Rush and the community. I love working with the residents. And yeah, excited to share that with you. I will pass it to David.
Thank you, Sarah. My name is David Mendez. My title at Rush is Associate Director of Data Systems and Reporting in the Office of Philanthropy. In a nutshell, what that is, it's more of a technical position. I'm responsible for maintaining our database. We use an Ellucian database called Advance. That's where we store all of our information. So I'm responsible for the upkeep, any issues or problems, I take care of that. And pretty simply, I do a lot of the reporting in the office. As you all know, technology changes, so our office is changing with that as well. And now that we're all working from home, we're starting to develop technology in which a lot of our mailings and letters are going to be automated, where we actually don't have to be there. Letters don't have to be sent out. So those are some of the things that we're doing. I've been at Rush since April of 2015, so it's coming up on 6 years. A little background about me is I'm actually a DePaul alumnus. I'm actually a double demon. I have 2 degrees from DePaul. I worked at DePaul actually in several capacities. I worked as a student, I worked in the Career Center. As a full-time staff member, I worked in housing, I worked in advancement, and I also worked in grants and research. So I didn't really have one specific job. The one thing that I did learn from DePaul, specifically the Career Center, is networking. And the reason why I say that is one of my supervisors actually worked with someone at Rush. And they told me about an opportunity to come to work in the Office of Philanthropy. And actually, this is what helped me get that position there. To be honest with you, both of my supervisors are DePaul alumnus. So that network really helped me get this job. So the one thing that I always tell people is that DePaul has a really strong networking and a very strong network, especially in Chicago. So it doesn't hurt to reach out to someone, whether you know them or you don't. More than anything, the resource at the Career Center, but also DePaul alumni are really, really willing to help you out. And I'm a case for it because most of my actual experience was at DePaul, my professional experience at DePaul. And so when I took that opportunity to leave DePaul and go to Rush, it was through a DePaul contact. But that's my story kind of in a nutshell. And I think we pass it back to Benji, I think.
Yeah, thank you, everybody. So yeah, so you can see a kind of an assortment of how people ended up here, and in coming here, they've I know that Mitch and Sarah, you've touched on this too about feeling a pretty solid connection to it, and I know that's something that's kept me here. I realized I didn't mention I've been here for I've been at Rush. I'm coming up on 7 years now, which is kind of incredible when you think about longevity in jobs today. And I remember when I first started there, that was something that that a lot of people had pointed out, that they had been at Rush for a very long time, 10, 20 years, and they still felt connected. They still felt engaged by what was happening there. So with that, back to the panel, wanted to get a sense of, give me a typical day, realizing, in such times, typical is kind of an odd word, but tell me about what you do on a given day that has an effect in relation to the medical center. And Mitch, if you could kick us off.
Yeah, of course. So as I touched on earlier, I'm a recruiter here. I specialize in recruiting RUMG non-clinical positions, more at the entry level. So these positions consist of clinic coordinators, access specialists, project managers in some capacities, administrative assistants. So most of the roles that I deal with directly do not require a bachelor's degree or higher education. These are more entry-level roles. And essentially what my day-to-day looks like is I'm going through applications, screening resumes, screening applications, conducting pre-screens, conducting interviews, scheduling interviews, passing along candidates to managers, getting feedback from the managers, how their interviews went, conducting intake meetings with the different groups that I work with for new positions that may have been approved, and kind of just working through the whole process from start to finish with a position. And that's kind of what my day-to-day looks like. It kind of is sporadic. It doesn't always look the same day-to-day. Sometimes it's heavy with interviews. Sometimes it's busy work getting positions posted and up to our job board. And speaking of that, I think Kevin shared this in the chat, but I'll share it again, which is our careers page. And if you guys are ever interested in looking at any jobs here at Rush, visit this link. You could search by different posting categories. What that means, you could search by professional roles, by health information roles, information services roles. And I definitely encourage you to check out our careers page and see what's there. I know when I was, about to graduate, I was, looking through LinkedIn a lot and just seeing what was out there and what may interest you. So definitely recommend looking at that. But that's a little bit about what my day-to-day is. But yeah, I'll pass it over to Sarah then.
Thank you. So my role is incredibly, I've lost the word. I want to say cyclical. It depends on the time of the year. Because I work for a residency program and they operate similar to somebody in school, it's by an academic year. So depending on the time of the year, it greatly influences what I am working on. We have just finished up our recruitment season, which takes up about a third of the year. We begin interviewing in November and of course planning far before that. So we are interviewing fourth-year medical students to try and find our next class of residents. Tonight is actually the deadline where we submit our list of applicants. And it's very similar if anyone is familiar with sorority and fraternity ranking. It is an algorithm that mirrors that sorting system. So programs submit a list of applicants, applicants submit a list of programs, and an algorithm will match them as close to one-to-one as possible. So today is the day that applicants and programs submit their list, and in about 2 weeks, we will find out what the algorithm has in store for us. So recruitment is a big part of my job that just wrapped up, and that has, you know, setting up interviews and all of that. And then bigger picture, our residency program is accredited through a national organization. So there's a lot of things that we have to do to make sure that we are compliant with that accreditation and keep our residents on an individual level compliant to those requirements. That also includes like what rotate their scheduling, the resident scheduling. I do administrative work in as far as managing our website, managing our Instagram account. I used my video background to make lots of videos for our recruitment season, especially since we were virtual. We also have to maintain certifications and licensures for the residents. It is one of those jobs where it's sort of hard to put into an elevator pitch. You really are doing so many different things, and every single day is different. And every single task, every resident is different. And so I definitely have to sort of flex some customer service muscles of accommodating physicians, faculty, and residents, and kind of customize their experience to what they need. So you definitely have to be on your toes and ready for anything and sort of able to do just about anything, which is one of the reasons why I love this job. All right, I think that's probably enough. I'm happy to explain more and give more detail about the timeline of the year and day to day. Yeah, really, it's new every day, which I love. I'll pass it to, I'll pass it to David then.
Thanks. Yeah, with my position, it's different every day. They're not one day is the same. It's always kind of an adventure. And I actually work with Benji, so we work in the same department. And one of the things that we're doing now, since it's the new normal, that we're going to be working from home, we're coming up with new and different ways to kind of present and do a lot of our work. I do not have a technical background. A lot of my technical background I learned, honestly, I learned by books like SQL for Dummies. That's how I learned how to write SQL. I watched some YouTube videos. That's how I learned how to do most of my stuff. And obviously just people along the way were teaching me. So we are going to create some videos in our office that kind of train people instead of having the in-person training. Well, I'm now responsible for learning how to create videos for people. So this is what we're doing every week, every month. You're learning something new. We're learning a new program. It's called DAX that helps us write reports into Power BI. So it's, for me, maybe the dorky part of me thinks it's a lot of fun because you're learning new technology, you're learning new things every day. My job is never the same. It goes from one day of having meeting after meeting with individuals on Zoom to others writing 3,000 or 4,000 lines of code to, you know, learning how to make a video to learning how to post that video onto YouTube and making it private so only your coworkers can actually see it and things like that. So it varies day to day. For me, it's a lot of fun, obviously, because my background isn't this. I was a political science major and now I'm doing tech work. So it's a lot of fun for me and it changes every day. So I'll pass it back to Benji.
Yeah, thank you. Yeah, David has a dubious honor of being one of the most effective problem solvers that I've ever worked with, which means he gets called in for a whole lot of things like that. But that's kind of, you know, I'm similar to, but you know, both David and Sarah. I too, my day changes quite a bit. I kind of straddle between, creative work, which is mostly story writing, and so, and social media posts, to, technical. So that'll be, some HTML coding for our emails, kind of doing some workarounds with our content systems, making sure the website's up to date. And we went through a new launch where we combined all the websites of the, the various Rush systems onto, into one website for roughly 3 to 4 locations. So kind of running the kind of content integration, all that, which I realize is a kind of a foofy way of saying making sure that everybody's represented in the web pages themselves. But the thing is, there's always a chance to touch on something that's meaningful, and that's something that's kept me really involved. I too do not have a technical background at all. I've learned a lot of the the coding and even a lot of the social media stuff as I've been at this job, and just Googled myself through to be able to solve these problems as they've come. But also today, I've been working on a story about a program that a foundation decided to donate to, where a researcher's found a way to regenerate heart tissue after a heart attack. Now, this is still in animal studies right now, but the fact that that's even possible, to me, as somebody who grew up as a science fiction nerd, that to me is absolutely mind-blowing. That's one of those conditions that you heard throughout your life. When heart tissue dies, it's gone and it's not coming back. But sure enough, there are researchers, even with everything that's happened with COVID, that are still working on these absolutely mind-blowing things. And that's just, one of many examples. And I think with that dovetails rather into a topic that I know is very dear to me at Rush, and that's Rush's community involvement. And so what I'd next like to ask is get a sense of what if any volunteer projects or ways that whether that was involved with our West Side work and our community service work, or even ways to enrich our office. David and I serve together on our office's engagement committee, and it's basically a way to find out how can we just make our office run more smoothly in a variety of ways. That's involved programming, but that's also involved, coworker relations, conflict resolution, all sorts of different things. So it's a pretty broad array there. But if you could, is there any particular, community involvement aspect that you've really appreciated in the time that you've worked at Rush? And Mitch, if you could kick us off.
Yeah, of course. So being within recruitment, one of the things that jumps out to me and stands out to me is the Rush Anchor mission that we have here. So essentially what the anchor mission here at Rush is it's a commitment to the West Side of Chicago here, which the community we serve, trying to help it with some of the discrepancies that are in the West Side community. And so they do a lot of work with local businesses within the West Side, a lot of the members within the community. It's just a really great piece that I really value here that we partake in. And you're definitely able to learn more about this by going to our page if we talk about the Rush Anchor mission, but just the commitment to the West Side community. I know Kevin works closely with this as well, and he may even be able to elaborate on this a little bit more than me, but it's just something that we're really prideful in, and just working with the West Side community here at Rush.
Yeah, actually.
Oh, sorry. I don't know if Kevin wanted to jump in or if we want to hand it over to
Kevin,
Sarah.
if you'd like to, that would be great.
Oh, sure. Hey, Kevin Irvine. So I work in talent acquisition with Mitch, and I work on diversity recruitment. So recruiting people with disabilities for jobs at Rush, as well as veterans and people who live on the West Side. And yeah, the main thing is just Rush is using all of our resources as an anchor institution on the West Side to reduce the health disparities and the health inequities for people in the West Side and the rest of Chicago. So that means sourcing, doing contracts for businesses in the West Side, breaking down our contracts into smaller chunks so that smaller businesses can bid for them. Catering, whenever we do catering, we try and work with West Side vendors. And then local hiring. So hiring as many employees as we can from the West Side communities, and making sure that they have the resources and supports they need to stay at Rush and grow in their careers. So it's a very comprehensive effort. It's a system-wide mission that we have. And I'll put a link in the chat to our anchor mission, because it's one of the things that makes a lot of us really committed to working at Rush and excited to work at Rush, because we're not just trying to provide healthcare, but we're really trying to make a big difference in the greater community. Thanks, Mitch.
Okay, Sarah.
Sure. Yeah, I will. I definitely want to echo everything that has been said. Rush's anchor mission is it's not just talk. It's not just marketing. It is one of the reasons why I wanted to work at Rush, was to engage with my community. And part of my job is ordering lots of lunches for the residents. And I will say, we do indeed order from West Side and South Side small restaurants. We have a whole list of resources that we share amongst ourselves. In terms of the residency program, we do a few different things regarding outreach. We work with, and Rush has an established relationship with a local STEM high school, Crane High School. It's very close to the Rush campus. And my program, my MedPeds program, actually hosts an annual Well Adolescent Night, where the high school students, the Rush University medical students, and the MedPeds residents all get together in our clinic and kind of go through what it's like to give an exam to an adolescent. It's really fun to engage with the high school students. Of course, their number one question is this just like Grey's Anatomy? Is residency just like Grey's Anatomy? And it's really fun because, we have to break the news to them that no, it's not. But then we give them a stethoscope and the nerve. Of course, I don't know the clinical terms for all this, but we have fun with them and expose them to pathways to medicine. Rush also has a initiative called Reach, and it is an internship program for high school students and college age students to get experience working in a blood lab at Rush, in the pharmacy, in a clinic. So we really are thinking, down in all aspects of the community to expose healthcare opportunities, be it clinical or non-clinical opportunities, to expand the pathway to medicine, so that our patients have doctors that look like them, and that's really important for quality patient care. I'll pass it to David, I guess.
Yeah. So with me, one of the things that attracted me to Rush was they had something similar to what we have at DePaul. At DePaul, we have Ascension Service Day. And at Rush, they do have something similar. Usually it's around Martin Luther King Day. They have a service day on that day where they go, and obviously it's students, it's also staff. They go and they, do all this service around the west side of Chicago and wherever they need to. And so I think that's one thing that I've seen that Rush does. And that was one of the big components I liked about DePaul when I was a student, when I was a staff member. And so that was really big for me that it happens here. And it's awesome to be a part of it. It brings you closer to the community, even though when you're at DePaul, there's a community, obviously, because you're a university. And sometimes you don't realize that even though we're at a hospital, we're still a pretty close-knit community. And that's one of the ways that, for me, that's how we get a little close-knit, because the Office of Philanthropy is detached from the hospital. We are about a block or two away from it. So we're actually not there. I'm not sure if Mitch and Sarah work inside the actual hospital, but Benji and I don't. So it's a little harder for us to be connected to the hospital, but this really does help us out a lot. And pass it to Benji.
Okay, yeah, thank you. Oh, yeah, Sarah, I'm glad that you brought up Crane Academy. We've also had basically like imagine like a mock networking event where, we've been asked to, to come in, ask students a series of questions and, essentially grade them on how they interact. And I got to tell you, I have never encountered more adult 17 and 18-year-olds in my entire life. Listening to them talk with such clarity about what they want to do and why, made me wonder if I'm as clear as they are. And that's just one example. It's such an interesting array of really practical, hands-on, and also, like you said, walking the walk efforts from, food and supply delivery to, just supporting local businesses, neighborhood cleanups. It's a really, really long and detailed list. Anything you really want to get into, you really can, and that's encouraged. So this one's going to focus a little bit more on HR and talent acquisition. So yeah, Kevin, if this is another one that you'd like to weigh in on, but Sarah and David, if you've got thoughts on this too, definitely please share. So what are other non-clinical roles at Rush that you would say students should be aware of that they might not be otherwise?
Yeah, definitely. So I don't know of all the titles and all of that to the extent, because I don't necessarily deal with all of them. But just like any other organization, there's a lot of professional career paths within Rush that you could take a look at and utilize. There's from IS, IT, management roles, marketing team, philanthropy, as David and Benji are on that team. There's a lot of different career paths that you could look at and kind of investigate. So depending on what your major is, depending on what you're interested in, I think it's kind of an open box, and you kind of just got to take a look at. Like myself, like I said, I was a business marketing major. Upon graduation, I wasn't really sure what I wanted to do. Ended up landing a job as a recruiter at a staffing agency. And that's kind of how I got my foot in the door then at Rush, because I had that experience at a staffing agency. So I think it's one of those things you got to kind of take a look at our careers page and see what kind of interests you. Like I said, you could select different professions to look at. And from there, you can kind of go down those paths and see what current openings we have at the time. And that's kind of my best advice, just because there's just a lot of different avenues and a lot of different career paths that you could potentially go down depending on what your major is.
A question for Mitch or Kevin. What are some of the entry-level roles that you might see on the Rush career page that don't require previous experience? I know you were talking about maybe a patient care technician. What are some of the other non-bachelor's degree or maybe just bachelor's degree required positions?
Yeah, so some of the positions that I specialize are positions that don't require a bachelor's degree. And even if they're, if you're a student and you're looking for work that maybe you're trying to get your foot in the door with a healthcare organization, just to get that experience, some of the roles that you could kind of look at would be clinic coordinators. You don't require a bachelor's degree for that. And it's one of those, you kind of get a great experience into what a hospital and a clinic is like. You're greeting patients when they come up, you're taking calls, you're just doing a lot of hands-on work within a clinic. So clinic coordinator is one of those. Another one that maybe is a time passer while you're getting your degree and you're trying to potentially just learn more about healthcare organizations would be one of our access specialist roles. That's another role that it doesn't require a bachelor's degree, but you get great knowledge within an organization. You really learn the different clinics and the different departments within the organization. So those are some of those. And then for roles requiring a bachelor's degree, it's wide open. There's a lot of different roles, and if anyone had specific questions for different areas, we could maybe branch off of that. But there's just an array of different, positions in that realm.
I think, Mitch, you covered a lot of what the basics. I think the most important thing is to know that there's so many different types of positions, and so I always tell people, look at our careers page, look at different positions, and if it's something that you don't know anything about, just look at the job description, the qualifications, the requirements, and if you have any questions, send us an email. We have an email address that I put in the chat, so rush_recruitment@rush.edu. And if you don't have a question that, if it's not answered by what you see in our job postings, send us an email and we'll try and get you answers to those questions. And I also tell people, look through LinkedIn, find people who are doing that position on LinkedIn and see what their path has been. how did they get there? Because I think one of the takeaways that I've seen with this panel is, we have lots of different ways that we get to where we are. And so don't worry if you don't know exactly how to get there. Find someone who's doing something that looks like something you might want to do, and look how they got there, and go from there.
Similarly, there's another question. Are there any positions that could help a student to gain clinical hours, or are these only offered through volunteer opportunities?
Yeah, that's a great question. So in regards to clinical hours, two positions that we do offer that I know, people trying to get those hours can do would be a medical assistant role or a patient care technician. Both of those are great entry-level roles for students that are still studying, whether that's to become a nurse, an RN, or even further up than that. But being a medical assistant or a patient care technician are both, entry-level student roles that are a great way to get your foot in the door within a healthcare organization and advance those clinical hours.
Sarah, do you have something to add?
I could add a little bit of detail, just my experience. Because I have essentially two part-time jobs, I have two offices. One of them is inside the back of our MedPeds clinic, and I cannot speak enough about the importance of the clinic coordinator and the medical assistants, and the patient care technicians. I mean, you are really like boots on the ground, and everybody relies on you. In terms of our MAs, they have a wide range of responsibilities and exposure to procedures, and of course, like shots and exams. And our clinic coordinator, keeps everybody organized. So, and then for me personally, I didn't know that my position existed. I didn't realize that this was an entire industry and career, graduate medical education. So I would just suggest that you think creatively. Anytime that there is a program of any sort, there is an administrator keeping it all together. And one great thing about my job is that it is a requirement for our accreditation. So not only is working in a healthcare industry great job security, but for the program to exist, they must have an administrator. And so I think that there's a lot of creative ways for you to get exposure into an industry or a department or something that you would be interested in. So it's out there. Definitely ask for help. Kevin is a wealth of knowledge. So yeah.
David, anything to add? Okay, well, so just to give you an idea of how this looks in the philanthropy office, a lot of the entry-level positions are either administrative assistants or development associates, and so they work in support roles for some of our different giving areas. So we have annual giving, which is generally most of the online level giving. So that's gifts from $5 to roughly a couple thousand. We have what we call major gifts, which gets more into 5-figure gifts, all the way up to trustee and principal gifts. And an example of that is the Rubschlager family that donated actually $30 million to Rush, and we've renamed the tower after them, and they've funded fully the building, the new outpatient building that's being built right now on Ashland and Harrison. And the interesting thing, in at least in philanthropy, is that I've seen, especially been there 7 years, I've seen people progress from those roles, very high up in different ways. They've become full-fledged gift officers now, where they have a portfolio. So they might be they might be working on donations for pediatrics, orthopedics, movement disorders, cancer, all sorts of different care areas. Making sure that community service efforts are funded also fall into that too. In particular, one friend of mine was feeling like she hit a dead end working with a restaurant group with a particularly shady head of it, and to the point where employees weren't even getting paid. And we had an administrative assistant job open there. It was roughly only a few months after I had started, and she started now, and today she and I had the exact same title. And by contrast, I started as an assistant director, and also I had absolutely no experience in healthcare before this. I had written some stories as a news reporter about different health issues, but it was not the main focus in any way. So, to Kevin's point, to think creatively and to, be direct in contacting people that are there and just asking them about it, that absolutely can work. And that's actually how I ended up there as well. So I realize we're kind of already there to some extent, but, what advice, would you have for students who are interested in working at Rush or another major hospital of some kind? And let's mix it up a little bit. Sarah, would you mind leading off on this one?
Sure. Advice I would have for somebody working at Rush. Well, I think that this is something that could be applied almost anywhere. But I want to put this in the right way, sort of like, don't let discouragements get in your way. I think that especially at Rush, at a big institution like Rush, there are so many different departments. And for people in my role as coordinators for graduate medical education specifically, many of those people rotate programs. So if you're working for a program, a residency program or a fellowship program, and the program director is just not quite your vibe, there's other opportunities that you can work in a different program, and you can sort of move like laterally, or depending on how you see it, up or down. So I think that my advice would just be like persistence, and like your team means everything. And if it's not the team for you, there's another opportunity for you. It doesn't necessarily mean that you're in the wrong job, but perhaps you maybe need a fresh start with new people. I hope that wasn't too much of a negative advice, but yeah.
No, actually very, very practical.
Yeah.
And, and I fully agree. Yeah, David, care to weigh in?
Yeah, I think my advice is, I guess, keep your mind open. For me, I did a lot of networking to get to this position, and one of the main selling points was the ability to actually grow. And for me, I think that's the biggest issue. I started off as an assistant director, and now I'm an associate director, and being able to learn a lot more, and just keeping an open mind. I mean, I never thought I would work at a hospital based on my degrees, based on my experience, and especially the job that I'm doing. I don't have a technical background, and I'm doing technical work. I always tell a story of that. One of the main programs I use is SQL, and it's actually SQL, but I thought it was actually the word SQL, like SEQUEL. That's how much I knew about it. That it was just one of those things where I kept my mind open, and especially here, I'm being taught so much that we're actually now talking about what it's going to take for me to go to the director level and higher. And so if you're willing to learn and you're willing to adapt a little bit, working at some place like Rush is really going to help you grow. And whatever it is that you want to do, you'll do it. We have everything here. And just in philanthropy, we have technology, we have finance, we have all of this that's here. Sales, we have it all in just one department, and that's everywhere else. So I guess the main thing is just keep your mind open, keep your options open.
Yeah, thank you. Mitch?
Yeah, and David brought up a great point there. I don't think really if you're in a non-clinical degrees path that you necessarily think you're going to go into a healthcare organization. I know I certainly didn't. Like I said, I started at a staffing agency, and after that, I wasn't really sure where I was going to end up. But I found the opportunity at Rush, and I think that's the main thing. It's that healthcare organizations, even if you're not a clinical worker, all the way down from EVS to AVPs, we all make a huge impact on patient safety and patient care. And it's really rewarding work, no matter what you're doing in what capacity. So I think it's just all about exploring about what you're passionate about, what you're pursuing your degree in, and how that could relate to a role within a healthcare organization. And that's kind of how I ended up here. And I think that's how a lot of people end up within the organization. They don't necessarily seek out that they're going to end up with, a hospital, but one thing leads to another, and it's just really rewarding work. And I can attest that, the first role I was in, I wasn't as passionate about it, but every day coming into work at Rush, you just really feel passionate about what you're doing, because you're making an impact for patient care and patient safety, even if you're not the one that's the registered nurse or the physician, but you're making an impact on their day-to-day. So that's kind of my word of advice, and just, expand your horizons, look at what's out there, compare that to what other positions are with other organizations, and just do your homework and always keep checking our job board, see what's out there, and see what interests you.
Okay, well, we're starting to get a little tight on time here, and want to be mindful of that. So really, at this point, just wanted to open it up to attendees. If you have any questions, any direct to any of the panelists, please fire away. Feel free to unmute or send in the chat. Come on, don't be shy.
All right, I have a question for Mitch. I know that you said that, or all of you, I guess, you guys said that you don't have to have an experience in the medical field in order to get a position that's, with Rush. In terms of actually applying for a position, how can we have our resume stand out so that way we're not singled out because we don't have that medical background for those non-medical or positions? Because I've looked at some of the, I'm sorry, I looked at some of the jobs already, and some of them already said that you needed to have medical knowledge and things of that nature. So I'm just trying to figure out what you need to do.
Yeah, great question. So obviously, when you're looking at a certain position, depending on what the job requirements are and responsibilities are, there are some non-clinical roles that do require some medical terminology, and there are some roles that do require that. But I would say a majority of positions here don't necessarily require a medical background or medical experience. Most of them, it's a bonus if you do have that experience, because obviously it would be helpful and useful. But majority of the roles here that are non-clinical don't necessarily require that background. So in terms of how to make your resume stand out, as a new grad, I think it's just best to have it less cluttered as possible. I'm sure you guys have already went to resume builder courses or, events that they talk about it, but just try to remove all the fluff from there. Us recruiters, most of my positions, I'm seeing anywhere from 50 to 150 applicants. So when I come across resumes that are just filled with fluff, it's just an easy way to get it rejected quickly, just because we're trying to sort through a lot of these applications all at once. So try to be as clear and concise and really present the information that you're trying to get across to the recruiter as clear as possible. And that's kind of some of my recommendations. I know as a soon-to-be grad, you may not have that professional setting experience, but just try to touch on some of that volunteer work you maybe have done. I know with the pandemic this past year, it's probably put a wrench in that plan, but any volunteer experience, any work you've done within organizations is huge. And then any internships and stuff like that. I think that's what really sets you apart. It shows that you're a go-getter, and yeah, in short, that's kind of what I would say to that.
Okay. All right, thank you.
Mm-hmm.
I'd like to add one thing, and of course, this is not about your resume, and this would be sort of after that part of the process when you get to an interview. I think just expressing interest in learning about medicine and interest in supporting healthcare providers goes a really long way, and it does show that you have something to learn, but that means you want to be there. I feel like somebody who wants to be in their job is you can tell right away if somebody doesn't want to be doing what they're doing. So I think just expressing your interest and passion in learning and growing, I think that could really help. And I'm sorry, I don't work in talent acquisition, so this wouldn't be something to, this would be, I guess, once your foot is already in the door. But personally, I am still learning. I don't know everything and I support medical residents, I support physicians, and I don't know everything that they do. I just learned, what nephrology even refers to. So it's okay if you don't have, all the answers. And as we learned, some people are Googling their ways through, work, and yeah, we can all attest to that.
Yeah, that's an excellent point. I mean, even in times when we've interviewed, people for my team, there was a real distinct difference between people who were like, oh, well, this sounds interesting, to people who were like, I've read about Rush, I know about it, I want to be a part of this, I like what the mission's about, and we've really seen that. I've seen those two exact side-by-side examples when interviewing, for our team. So yeah, that's very worthwhile to emphasize. Right,
All
any
right,
other
thank you.
questions?
Thank you, guys. Thank you.
Yeah, absolutely. Great question. Anybody else? Anything at all?
I was kind of wondering, Mitch mentioned Fluff. Could you be a little bit more specific? What kind of things do you consider Fluff in your resume?
Yeah, that's a great question, Dominic. Essentially, Fluff, I mean, when you're going through your experience, say you had an internship, you don't need to list out every responsibility that you did. There will be some times when you get resumes that are upwards to 2 to 3 to 4 pages for a new grad. At that point in your career, you just don't have that much experience to have that much on a resume. And some, bullet points are 7, 8 lines long, and that's just extensive. We can get the gist of it just from putting in bullet points of what you were required to do, some of the skill sets you did, and just try to be as clear and concise as to what you were doing. It doesn't need to be an essay about that, and that's kind of what some of the fluff is, if that helps.
Yes,
Yeah.
that makes a lot of sense. Thank you.
Yeah, and going off on that too, and again, I am not a recruiter, so definitely consult with actual career services people when you're doing this. But one thing that I was very fortunate to learn, I'd say about midway through my career, that I never learned earlier, and I wish I did, when writing a resume, don't write the job description, write what you accomplished at the job. So try to quantify whatever it is. If you were, let's say you had to do reports for some odd reason, how many did you do in a month? Or how, find some way to show what you actually accomplished in those tasks in the description, right? So if your thing is, I don't know, 5 bullet points, rather than, again, just what you were supposed to do or told, and I know it's kind of an esoteric idea. So depending on what you did at these roles, it's going to take some real thinking to flush out. But something that I've passed on to many people, who've been, looking for jobs at different times, and it really pays off. If you can show that, that's an excellent way both to cut down on the fluff and to stand out. And if I'm wrong about that, actual recruiting people, please chime in.
That's it. You want to?
No, you hit the nail on the head there, because I was just going to say, example for myself on my own resume, I try to put those numbers and those stats of what I'm actually doing in my current role. That it quickly tells another recruiter essentially what I'm doing in my position, and it shows you the numbers exactly how I'm doing it. So just providing evidence to what you're doing and not just saying the job description in your resume is extremely helpful, and that cuts down on the fluff.
Betsy, do you want to add anything? Oh, Kevin, please go ahead.
Can I jump in with one more thing?
Yes, of course.
I think it's really important too, to think about, at least at Rush, our applications are actually reviewed by human beings, not by a robot or an algorithm. So tell your story. And, when you have a chance to highlight, even an essay question, think about giving answers that only you can give, because, when you're looking through all these applications, you can see some of the same kind of boilerplate language that anyone could have written. And if anyone could have written it, then guaranteed many people have already. So think about what's unique to your experience, your story. Show what you know about the position you're applying for. I mean, just make it clear that you're applying for a very specific position and that you know something about it, and tie those, tie some parts from that job to your experience. Don't just say, please see my resume, you know, because Mitch is busy. He's got so many applications and resumes he's going through. He's not going to, you know, go through your resume and try and pull out the good stuff. You know, you've got to highlight that and make it easy for him to find the good stuff and find the parts of your background that connect to that job you're applying for. So, you know, make it easy for Mitch and tell your story. You know, maybe you won't get hired, but you know, be yourself.
Liz Martin, you got your hand up there? Liz, you're on mute.
Sorry, I'm very surprised that you all don't use any software or anything to pull resumes. So I'm wondering, for recruiting people, how are you finding your talent? Like, how are you going out there? Like, cause you know, we're told, oh, go LinkedIn, blah, blah, blah. But like, I'm just wondering, like, how are you finding your talent?
Yeah, so to that point, we still use an applicant tracking system just like any other recruitment process would. Our positions are posted on LinkedIn, so all of our applicants that come in, they all apply through the same way. They come through to us in the same capacity. From there, but what kind of Kevin was touching on, one of the things that's unique about our applicant tracking system is we can put in unique questions that require essay responses. And a lot of the times we'll have candidates that will just put in, you know, please see resume. And that I see that 100 times a day. And when it just takes 5 to 10 minutes of your time to put in your unique story for these essay questions, because we wouldn't be asking them if we, you know, already knew your story. So to that point, you know, how we're finding our talent, just like any other recruitment process, we have an applicant tracking system. Candidates apply through our careers page, and then they come to us. I hope that helps your question, Liz.
All right. Well, thank you so much. We are just a couple minutes over time. So I'm gonna, while we're wrapping up, I put up a survey. So if all the students could give us your anonymous feedback, that would be super helpful. Thank you so much to our colleagues from Rush. Thank you to Benji, our facilitator, and to David and Mitch and Sarah and Kevin, our panelists and advisors. Thank you so much, everyone, for joining. Sarah shared her contact info in the chat. Thank you. And we hope that you, and David, thank you so much as well. Always great to bring back a blue demon, and especially a double demon. Yeah, thank you all for joining us. Thank you, and everyone's sharing their contact information. So definitely copy down those email addresses. Be in touch if there's a position that you see or if your question didn't get answered. I know we had a lot of great discussion and a lot of good questions. And we'll send the video. We'll include links to the Rush career page as well. And thank you so much, everyone, for joining us.